A lot of things can actually go wrong in your pregnancy journey, and that's because you do not take a particular step at the right time. Yes, please note these two. There are two keywords in what I just said. There is a particular step, and there is also at the right time. You can take this step, but is it at the right time that you took this step? So both are very important. Taking this step and taking it at the right time. I know that most of you do not do this intentionally. Maybe the excitement of being pregnant, you were overjoyed and all that, so you were overwhelmed that you could not remember to take this particular step, or maybe you're very busy, or a lot of you feel like you're overconfident, maybe because you're not throwing up, you're not having the symptoms, you're not sick, you're very okay, so you feel like taking this particular step does not really matter. Hi beautiful mama, welcome back to my channel. Okay, yeah, I'm making this video today because of most times when I drop pregnancy tips, healthy pregnancy lifestyle and all that, there are some questions that I get from most of you that keeps me wondering, like, why are they asking me this question? It keeps me wondering, like, do these people attend antenatal at all? There are some questions I know that it's okay for you to ask some certain questions, but there are some certain questions that I also see that keeps me wondering, like, these people do not attend antenatal, so I feel like there is need for me to create this awareness. As a first time mom, a lot of things can actually go wrong in your pregnancy, and that's not because you don't care or you're not capable of mothering a child, or the well-being of the baby inside of you or you is not important to you. That is not actually the reason. Maybe the reason you're not taking this particular step would be that, okay, pregnancy came when you were not expecting it, you're not financially buoyant, and maybe some of you are this kind of person that you don't really take everything serious. Maybe something comes your way, you take it with a little pinch of salt. You're not really bothered, or you don't see anything as a matter of urgency. Maybe that's why you're not bothered about taking this particular step, or maybe you don't have the money, or you're not even expecting it. That's why you're not taking this particular step. Yeah, and I'm not just talking about a first time mom, I'm also talking about those who have been pregnant before. Yeah, I'm also talking to myself because I am very guilty of this particular thing. When I was pregnant, my first pregnancy, I took this step, but my second, third pregnancy, I was very lackadaisical about the whole thing. But thank God for my husband that pushed me and urged me to take this particular step. If you're guessing what this particular step is, actually, yes, you're right. That is antenatal. So that brings us to what we are going to be talking about today. Antenatal in pregnancy is very important. I know that it is not intentional that you don't want to, but there are some constraints, there are some factors that has prevented you from taking this particular step, from going to antenatal. So today we are going to be talking about the safety of antenatal, not just for you, but the well-being of your child. It is very safe and important for you to go for antenatal during your pregnancy. So let us talk about what antenatal is. The word ante means before, and natal means the birth of a child. So antenatal means what you do before the birth of your child. It is very important. The things you do, the food you consume, the healthy habits you take during your pregnancy, it is very important. So before we dive into what antenatal is all about, I want us to quickly run a quick check on the things you should do before you even get pregnant. Before you start taking in, some of you have planned pregnancy, so I'm talking about those who actually plan their pregnancy. Please make sure you eat healthy meals, eat food that are rich in protein, calcium. Don't joke with your leafy green vegetables and all that. So before you consummate with your husband, please make sure eat healthily, and also take your prenatal vitamin. And your prenatal vitamin, I'm talking about your folic acid, that is vitamin B9, very important. Please make sure you take it before you start taking in. So let's go over to antenatal. Why antenatal? Why do you actually need antenatal in your pregnancy journey? In your pregnancy journey, your pregnancy is divided into three sections. We have the first trimester, the second trimester, and the third trimester. And this antenatal should be started during your first trimester. Your first trimester is one of the most crucial and important trimester in your pregnancy. I will not say it's the most important, but everything has a foundation, and I feel the foundation of everything matters a lot. And your first trimester is the foundation of your pregnancy. So please don't joke with your first trimester. The moment you notice that you're pregnant, please go to a hospital, go to the place you feel like this is where you can acquire the knowledge, the steps for you to take in your pregnancy journey. So go to a hospital quickly and register for your antenatal. Don't procrastinate. And if you're wondering that you're working, you don't have the time and all that, in your first trimester, in your second trimester, I think your antenatal days is even once in a month. It's not something you do every day. So don't complain that you don't have time. So the moment it's confirmed you're pregnant, you start your antenatal in your first trimester. So now let's talk about a lot of things that you're going to gain in your antenatal visit. So when you start your antenatal visit, they will check your vital signs to know your blood group, so that in case of emergency, maybe during delivery, then you'll not be able to talk. They'll just check your folder and they will know one or two things. They will know your history. So they will check your vital sign, they will check your blood pressure, they will check your blood group and all that. And after that, you will meet a doctor and they will ask you one or two questions. If it's your first pregnancy, if it's your second pregnancy, when everything is documented, they check. Most hospitals run their ultrasound immediately to check if your baby is well positioned in your womb, if it's not an ectopic pregnancy. Ectopic pregnancy is very dangerous. So they will check if everything is in order. Then they will now place you, they will now give you your next visit. And those of you wondering that you don't have time and all that, antenatal is not something you do every day. Is in your first trimester down to your second trimester, I think it's even once in a month. So yeah, so each visit you go for, they check your urine, they check if there is any infection, because they don't want you to transmit any infection to your baby. So they check your sugar level, if everything is in order. And you also have some lecture on healthy tips to navigate motherhood. All of these have been taught in your antenatal. They also give you your TT injection, so that you don't transmit any form of disease to your unborn child. So all of these are just basically what happens in your antenatal. It's not a serious matter. So when you go to the hospital, the first thing they do for you is to check your your vitals, which is your BP. They check your weight, they check every other thing. So in antenatal, there are so many things you have to do. In antenatal, they will check your baby, if your baby is all right through the ultrasound scan. They will check if everything is okay. And you know the dangers of ectopic pregnancy. Don't be in the house and assume that because you're not having the morning sickness, you're not vomiting, you don't have back pain, you don't have constipation, you're not urinating, that everything is all right. There are some things that cannot be detected unless you go for your antenatal. So in your antenatal days, they monitor your child to check if everything is okay. So they'll check your vitals, they'll check your blood level, your PCV. Very important in pregnancy. If your blood level is very low, when it's time for you to give birth, it will actually disturb you. So go for your antenatal where they check your baby's weight, they check your baby's position in your womb, if it's properly placed in the womb, if it's not outside the womb. And if your pregnancy is outside the womb, that is actually ectopic pregnancy. And ectopic pregnancy is very dangerous. In a matter of a week or two, it can actually kill you and your baby. So please go for your antenatal. In your antenatal, they will teach you the basic steps, all the signs and symptoms you have in your pregnancy, the basic um healthy tips for you to navigate in all the semesters. The basic step for I said semester, the basic step for you to navigate in all your trimesters. So the importance of antenatal in your pregnancy days can never be overemphasized. There are some of you that you do not even start your antenatal until you're already 6 months gone. If you're here watching me, you know yourself. Please, I don't want you to do that again. And if you know someone or someone that knows someone that does this, please tell them not to do it again. It is not safe for you in your pregnancy. And I'm also talking about those who that go to native places where there is no way to diagnose if there is any issue or not. Please don't do that again. Go to a hospital that have the necessary and the right equipment for you to start your antenatal. So your antenatal should be started in your first trimester, not in your second, not in your third trimester. There are a whole lot of things that they do for you in your antenatal. They check the total well-being of your health, they check your blood pressure, they check if you have any diabetes, and there are also some injection you'll be taking like the TT. So if you're in your house, how would they ascertain all of this? So please go to the hospital where they check if everything is okay, because in pregnancy your body is very open, and if they don't check all of this, you can transmit some of this disease to your unborn child, and I know that you wouldn't want this to happen to your child. There is also urine test you also do in your antenatal days. They check your blood and sugar level if everything is okay. And the most important of all is the lecture that you receive every day. That's why I said if a lot of you go for your antenatal, there are some questions you ask here that you will not ask, that you will not be asking me here. In every of your antenatal visit, before you see the doctor, there is session for you to have lecture where you can ask all the questions you need, all your concerns in your pregnancy. They give you lecture, healthy tips for you, your baby. They prepare you for labor. They prepare you mentally, physically, emotionally. They prepare you in every aspect. Everything you need to do, you need to know about pregnancy is being taught in your antenatal. Aside the medical tests they run and all that, there are also some healthy talks, health talks that are fully packed for you in your pregnancy journey. Additionally, they are also going to run an ultrasound for you to check your pelvic, to know how the baby is positioned. They also check to know the sex of your child, to know the baby's heartbeat and all that. And all of this cannot be done while you're seated at home. So even in your busy schedule, please make sure you create time for your antenatal. And I'm not just talking about the first time mothers. I'm also talking about second, third, fourth mothers, as the case may be. In fact, second, third mothers are even the ones guilty of this. They feel like they already know it all. But mind you, all pregnancies are not the same. Because you went through pregnancy A and it was successful, no complication, does not mean that, though I'm not praying for bad, but it doesn't mean that your second, your third, your fourth pregnancy will remain the same. So always go for your antenatal. Let them check your health condition so that you don't transfer anything to your baby. And please, if they give you your routine drugs, don't skip any of them, because if you skip your prenatal vitamins, is going to affect your child, especially the neural tube. Your child might have neural tube defects, which you might not want for your baby. If they should tell you what not taking a routine drugs can cause to your baby, you will not even joke with it. So all this knowledge, all these healthy tips are being taught in your antenatal days. So please make sure you don't skip your antenatal days. So all of these are actually basically what you need in your antenatal. Once you notice that you're pregnant, please don't wait for your second trimester, your third trimester before you start registering. Just go immediately, because it is very important for you and your baby. Don't be that person, don't be that pregnant woman that relies so much on Google. You know that you can actually get some information on Google, but not run scan. Google cannot check your medical condition. Google cannot do ultrasound to see how your baby is doing. Yes, you need some knowledge there, but you still need a physical hospital that you can walk in for them to monitor your pregnancy journey. And please let me also remind you, don't be those people that rely so much on natural herbs. Any little thing, you go and drink this and drink that, you might be harming your baby. So if you've watched to this extent, it means that you found value in what I just said now. My name is Daisy Peter. I'm a content creator based in Port Harcourt. For those that are just seeing me for the first time, all we do here is give healthy pregnancy tips for your pregnancy journey, tips on how to navigate pregnancy, tips for your healthy baby. If this sounds interesting and it's something you want to be seeing all the time, please, I want you to like, leave a comment in the comment section. Are you pregnant? Have you started your antenatal journey, or do you have a friend that does not listen to advice, does not go for antenatal? Leave it in the comment section. Let us know. And if you're yet to subscribe, please subscribe to this channel. Subscription is totally free. It will not cost you a dime. And mind you, I'm not a medical doctor. All my teachings are based on experience and research. So also do well to call your doctor if need be. Thank you for watching. Bye bye, and see you tomorrow in my next one.